every other country across the OECD thinks about healthcare with respect to a global cap, whereby there's a limit to how much is spent on healthcare. Certainly in my own country, in Canada, where we spend about 10% GDP, we've made explicit policy to only see the rate of growth of healthcare expenditure tied to nominal GDP. That is the growth that is afforded by the economy. So in Canada, the issue of sustainability actually doesn't come up because we're spending what we can afford. The US needs to look at that same perspective and say, let's only see the rate of growth of expenditure tied to how much the economy is growing in real terms. Once we get to that place, the affordability, sustainability issue goes away, in essence. Get the money out of the hands of the rich insurers, the rich industries, and reallocate those resources to places where there's the greatest need. And that's the kind of system that we have in Canada. Certainly in the UK, Australia, across Europe, we see this notion of a cap of how much is spent, and then individual decision makers having tools in hand to assess value and to make decisions about where resources should be allocated, where resources should be moved out of one area and into another area to get better care for the patients they're serving.